Good to have you with us here on the 9 p.m. edition of the Urban Debate. Viewers, Mirror now has constantly given attention to the issue of mental health. We've constantly, over the last several years, campaigned and asked people to talk about mental health, to make themselves aware of the various issues, to identify, to understand, to help those around them. And I believe that in 2020, where every single day it feels like apocalypse now, in 2020, with every single day throws new challenges at us, from a pandemic to a lockdown to a massive economic slowdown, jobs losses, education calendars thrown all over the place, a large amount of uncertainty, businesses shutting down, climate changes happening, forests on fire, with every single kind of a disaster that you can imagine being thrown at us. I believe it's one of the toughest years that we've come across. And that requires us to give mental health a lot more importance. And so today, on the World Suicide Prevention Day, we have one more time decided to talk about suicide prevention. Now, let me tell you why it becomes even more important simply from the point of view of the COVID, the pandemic, the lockdown. The lockdown has resulted in many of us being completely cut off from the rest of the world. We are isolated. Humans inherently are not very good at dealing with that. We are a social community. And when we don't get to do that, it begins to impact us. We may not realize it immediately, but it does. The pandemic itself has triggered huge amount of anxiety. There is a fear of catching the disease. There's a fear somebody around you may have the disease. There's a fear of stepping out, of going about doing your regular work. The sudden lifestyle change. People are having to work from their own homes. People are having to deal with a situation where you are in one room, four walls, confined to those four walls, surrounded by your family members, by your children, unable to talk to your colleagues directly, to your peers directly, unable to get out, unable to travel, and that kind of a change in your lifestyle also can make a big impact on you. Let me tell you why else it's important. There is so much of uncertainty. Many have lost jobs. In fact, over 2 crore salaried people, let alone the rest of the organized and unorganized sectors. 2 crore salaried people have lost jobs in our country. Others fear job loss. Many have seen massive, deep salary cuts and don't know how they're going to make their ends meet. Students don't know when schools will reopen, how they will reopen. They're all adapting to the online version. Not many have the access to online version. Teachers don't know how to really go about it. They're also learning and adapting. That is just simply cause for additional anxiety. Those who love sports can't go out and play sports so easily. That is a cause for a lot of anxiety and can play you down. And then, of course, are the people who already have existing mental health issues, who already may have been diagnosed with a certain condition and are finding it extremely difficult because they're not able to see or meet their counselor, the professional who would have helped them out. Just a few examples that I have for you of why it is important for us to again and again talk about mental health, understand it, learn to listen to people around us, become a little bit more aware of people around us. That's the only way we can save lives. That's the only way we can help our loved ones, our friends, our family, our colleagues. So tonight I have a set of experts with us to help understand what should be the signs you need to watch out for as somebody is going through a tough time, to help us understand what is it that we can do, to help us understand for suicide prevention what's really required. If you have a specific query for yourself, for somebody that you know, our phone lines are open. Our experts are sitting right here. Pick up the phone. Let's have a conversation. And I say good evening to the panelists who are joining us right now. I've got Dr. Dane Heel. He's the author of Being You, Changing the World, a book. He's also co-creator of Access Consciousness, a very renowned name across the globe. I have Dr. Lakshmi Vijaykumar, founder for Sneha, Honorary Associate Professor for University of Melbourne, member of the WHO Network on Suicide Prevention and Research. Dr. Rajesh Sagar, Professor for the Department of Psychiatry at AIMS, joins us this evening. I've also got Monish Malhotra, life coach and motivational speaker, with us this evening, and Nelson Vinod Moses, founder for Suicide Prevention Foundation of India. I'm really glad to have all of you on this conversation. Thank you so much for taking the time out. Let me actually begin with Nelson Vinod Moses. Nelson, just to put this in perspective, we may not have consolidated data already in terms of statistics of how this year is playing down on, and impacting us. But even outside of 2020 and the pandemic, the large number of suicides in our country has been a big issue that we rarely talk about. Just help our viewers understand that.
So, the rate of suicide that India has is about 60% more than the global average, according to the WHO. So, if the global average is about 10 point something per 100,000, India's rate of suicide is 16.5, roughly. Now, with the pandemic, we don't have consolidated numbers, but we have the NCRB numbers, where we have an increase in number of suicides from 1.34 lakh to 1.39 lakh. And what I'm hearing also is that we had a large corporate who reached out and said that in the first 6 months of 2020, they've had more suicides than the total number of suicides in 2019. So we've already had an issue with the large numbers. Now we are going to see this exacerbated. And we did a small survey among therapists, about 160 therapists, and they reported that almost 65% of their clients are reporting an increase in self-harm, suicide ideation. Those clients who had recovered are suffering a relapse, and they also facing, for the first time, there are a lot of new clients who are coming and seeking help. So this is both good and it's bad. It's just essentially showing that the situation has reached such a level that they're seeking help.
Okay, so in many cases, people at least understand that they need to reach out and seek help. Of course, the other part of it will be to how many can we really provide this help. Do we really have that kind of a system infrastructure available to help people out? But let me bring in Dr. Lakshmi Vijaykumar on that angle. Dr. Lakshmi Vijaykumar, we're given to understand that we have 3 psychiatrists for 10 lakh people in our country now. That's a scary number. When there is a rise in cases, when there is a rise in people who want to talk, who want to seek help, how do we deal with the situation?
Yes, you can look at it in 2 ways. See, you can look at suicide as a mental health issue, but in our country, I think it should also be a social objective. And however increase in number of mental health professionals you have, it will not be, for example, the total number of psychiatrists is about 9,000 or 10,000 in India for a population of 1.3 billion. So even if the psychiatrists done, and majority of them are in urban areas. So even if the psychiatrist does nothing but see patients who are suicidal, it will still not be adequate. The whole issue here is to enable people see, we have to look at it from the health sector, and even in WHO we have formulated the mental health gap reduction, where there is a suicide component. So any health worker, community health workers, ASHA workers, general practitioners, nurses, they can all be trained to identify, support, and refer a person who is suicidal. So the suicide prevention here should be multifaceted. It should not be only a health sector, but also a social sector, because if you look at our psychological autopsy studies, unlike the developed countries, where about 90% of people who die by suicide have a mental disorder, in India it is only about 50 to 60%. So 40% are due to a variety of other causes. So we have to combine both health services infrastructure plus social services infrastructure to make a difference. And the sad part in India is the fact that the NCRB says it's about 1,39,000 suicides. But if you look at the global burden of diseases study or the WHO global health estimates, it puts the figure for India at 2,30,000. And if you can think of any condition in India where 2 lakhs people lives are lost every year, and majority, 60% of them below the age of 40, it shows the enormity of the problem, and not only the enormity of the problem, the impact it has. So many young lives lost means it's a loss not only to the family but to the community and the country. And we need urgent steps to address this issue.
Okay, fair enough. I understand what you're saying now. The other aspect, and maybe Dr. Rajesh Sagar, you can come into that. Dr. Sagar, one, of course, because of a pandemic, a lockdown, a slowdown, there will be a few people who are already seeking, mental health, already were aware of what was going on in their minds and were seeking help, and they would have run into a roadblock. And then, like Nelson said, that there are new cases, fresh cases, people who've realized that they perhaps are not able to handle the situation. Now, to your mind, how do we tackle both these separate categories?
You're absolutely right. Actually, if you see, because of this pandemic, if we see that, those who are already having a problem, there is the exacerbation of problem to them. And also those fresh problems are also coming. Now, world over, I think the enormous amount of evidence which have been collected, it shows that the illness, mental illness, has exponentially increased. In fact, depression has gone up to 2 times, anxiety up to 3 to 4 times, and even other problems like sleep problems, panic attacks, panic disorder, and whole lot of post-traumatic conditions, stress disorders, and so on. So whole range of psychiatric disorders have increased. Now there are a number of reasons for that. Now, of course, it's pandemic is one thing, but all the associated thing around pandemic also is contributing to that. Say, for example, like loss of job, poverty, not able to go out, and so there are, and children at home, online classes, no help whatsoever. So one can imagine that the whole situation which has been created, the insecurity, you are not sure what will happen, and so these all have contributed to the increased number of mental illness. Now the point here is that we should not dwell too much on the diagnosis per se, like we say depression diagnosis or anxiety, but by and large it has been seen that psychological distress has increased overall. What it means is about 40 to 60% people in the range have what the evidence we have, they have this psychological distress. What it means is they are not comfortable with self, because of anxiety, because of insecurity, and so on. So, and on top of it, what is happening normally whenever we are, not feeling well, we are anxious, we seek help of others. But here we are confined, social distancing, wearing masks, and so on. So what is happening that the solace what one used to get in normal circumstances, we are not getting that. And again, the fear which is being created by the media, so many people have infected, so many people have died. So again, that has increased the whole load of morbidity of psychiatric illness. And also we need to understand that there are many young people or even vulnerable group like elderly people who are living alone, they're also vulnerable, and people who have a medical illness. A lot of focus is there on psychiatric illness, but we all know that people who have medical illness like heart disease or diabetes or any physical illness, they also have vulnerable with regard to psychiatric illness. So if we see this situation because of these many reasons, of course, because of COVID, but all the associated other conditions also is giving rise to very exponential increase of the psychiatric illness. In fact, people are also saying it's epidemic of corona, but epidemic of mental illness also, mental health problems also. If so that is why it is important that we need to discuss it. We need to gear ourselves up, with all the resources, so that we can prepare for our, this situation which will happen not only during this COVID, but I'm worried about, a lot of psychiatric mental health problems, worried about post-COVID also, what will happen after that, So it is important that we all need to discuss about it in length and, make strategy so that, we can help people, we can reduce the distress. The best part I think I can tell here is that if we are able to intervene it, if we are able to identify early, if we are able to, then we are able to help people in a big way. I think that's very important. That is why the importance of self-management is, one can empower people that how they can identify themselves, how they can seek help at early stage. That will always have a good outcome. A good outcome is they can be helped in a much better way without any repercussion, without any harm to them. So that is what the silver lining is, that if we are able to identify early the problems, so there are resources available, there are good management strategies available, so one can get over it without any problem, and you don't require so many medications or so many methods for treatment. Simple method is good enough to get over this situation. So I think that's very important, that we need to discuss and think about this mental health issue during this time of COVID.
All right. So let's the idea about the conversation today is for people to really understand, to be a little bit more aware, to be able to listen to those who may be going through a tough time, who may be having a condition, and then figure out what are their options, what should they be doing in such a scenario. Dr. Dainir, thank you for being with us and speaking to the viewers of Mirror Now. Help us understand, how do I spot it around me? What are the red flags that I need to watch out for, especially in these tough times?
Well, at this time, any major change in behavior, I would say, that's like a withdrawal, an outburst of anger, or a sense of sadness, or if somebody says, I might as well just end it all, I have no hope. And speaking to what the other doctors have spoken to so far, I absolutely agree. It needs to be more of a social awareness that we have. And one of the statistics on the screen, which I've seen all over the world, is the social stigma about anything dealing with mental health, especially depression or suicidal thoughts. So the majority of families are reluctant to acknowledge the illness. What I see is, as has been pointed out, we don't have enough psychologists and enough psychiatrists to reach everyone, but we do have enough people, if we take it upon ourselves to look at the people in our lives that we care about and actually have the willingness to ask them a question. Are you okay? What can I do to contribute to you? And one of the other big elements of what creates this in people's worlds is there are a lot of sensitive people out there where they're highly sensitive to judgment. They're highly sensitive to what is going on in the world, and they feel like they have no resource to let it out. 20 years ago, I was at a place where I was going to end my life. I came across something called Access Consciousness bars. And after an hour and 15-minute session, I never contemplated killing myself again. And we found that it's a light touch technique on the head. And we found that it decreases stress, anxiety, and depression by an average of 87% with one session. Now, I present that because that's one tool that's available. And we have facilitators around the world that are offering free sessions during September and October as a way of trying to give back to the community and decrease the stress level that people are living with. And it quite literally saved my life 20 years ago. But I think it's up to each of us. So, for example, in Australia, realizing the rising suicide rate, they created a national day called Are You OK Day, as a way of bringing this out of a stigma and into the awareness that on some level, all of us have some level of sadness, anxiety, stress. And some people have, and we also have this ability to actually contribute to each other. If we take that upon ourselves and recognize we might be the person that keeps someone from taking their own life, and we need to be willing to reach out in that way, but also we need to realize there's nothing wrong with asking for help. And let's face it, the world is stressed. We have 8 billion people who are stressed because of this pandemic and all of the associated things that are going along with it. And we need to recognize that not one of us is wrong for being stressed, but one of the other things, if we can recognize that we're all sort of like big psychic tuning forks, meaning in a pandemic with this many people vibrating in a level of stress, we pick it up. There are tools for letting that go. That's one of the things I work with people on is the idea that 98% of the thoughts, feelings, and emotions in your head are things you're picking up from other people. You can let that go, and then you only have to deal with the 2% that's left. So for me, I'd like to present a message of hope that we can, if we choose to take up the gauntlet, can truly be the source for change of this, and not just leave it up to our mental health professionals. And thank goodness we have as many mental health professionals as we do, and thank goodness there are as many as there are in India. And I thank you all for what you do. And please, if you're out there and you are in this place, please be willing to call a suicide hotline and just talk to somebody and let it out.
One question that often comes up is, how do you respond to when somebody reaches out or talks to you? Often it's said that it's not enough to just say, don't worry, things will be all right, this is just a phase, you need to pull yourself together and move on. Is it okay to say this and let it be? At what point do you decide that you need to maybe listen more, you need to tell the person to seek professional help? How does a person decide to what extent and how do we react to someone?
My point of view is, when they speak, be willing to listen and say, hey, tell me everything that is going on for you. I will sit here and I will listen. But the key to that listening has to be listening without judgment. And if we do, oftentimes the loneliness is one of the biggest parts of what gets a person to become suicidal. If we're willing to listen, we have the chance to change somebody's life, provided we listen with no judgment.
Okay, fair enough. That's an interesting point, that just listen. That's where you begin with, Monish Malhotra, that we need to say, tell people around us, we are here, willing to listen, maybe not necessarily respond or give advice, leave that to the professionals. Would that be correct?
Absolutely. Because for about 8 years in my life, I lived my life like it was a car with all 4 flats. Like, I felt like everything was punctured. I kept changing the tires, kept looking at mechanics to try to fix my tires. And then one day I had to suddenly look at, wow, it's not the tires, it's just the one flat road I'm taking every day. Meaning that I'm wrong and I'm not perfect, etc., etc., etc. Like, personally speaking, I try to do things that would kind of look like an accident, but it would actually be a suicide. Like, trying to be creative with it, which is what even, the doctor earlier said about suicide ideation. And I want to point that out here, that so many people have so many pressures on their life, not being perfect enough, not being normal enough, not being fitting in what everyone says is correct and right about them. So all of that led me to think that, I should die in a way that might look like an accident. And I tried 5 times. But the sense was, at one day I had to change the direction of my life, in the sense I had to take a different road. And that's when I realized that suicide was actually not the solution. That's when I realized the tires were not faulty, it was the road. It was the single thought I was taking. And in the sense, I don't know how many people in India and all over the world think that way, that, we should die quietly and no one should even know that we were depressed, and, we need to die quietly because we don't want to leave a legacy of shame, etc., etc., etc. But the sense is, I'm so grateful that Dr. Dane is here today, because Actually, reading his book, Being You Change the World, and getting one session, from someone who was a facilitator of the work he does and promotes, changed my life. And I've done so many.
Oh, we seem to have lost that line with Monish Malhotra. I'm going to try and get it back. Monish Malhotra there, sharing his own story, his own struggle for 8 long years. He says he went through, drug addiction, suicidal tendencies, and then finally it changed for him a day where he realized this is not really the solution, and that was about 2 to 3 years ago, if I'm not mistaken. We're going to try and get him back. I also wanted to thank Dr. Dain Heer. Dr. Dain Heer, I really appreciate the fact that you joined us and spoke to the viewers of Mirror Now here in India and shared your insights. But if I can just pick up from the point that he made and take it back to Dr. Nelson Vinod Moses. Dr. Moses, the first thing, of course, is some who may reach out to those around them, their family members or their friends. And what should our response be as the friend or a family member to someone who may be showing suicidal tendencies? What do we do to prevent it?
I'm not a doctor. I'm a survivor of suicide loss. I lost my best friend to suicide, and I didn't pick up the signs. And this happened more than 20 years back. And this was like a pebble in my shoe, which I couldn't get rid of. And that's the reason why I started this organization about 3 years back. In fact, I started to write about mental health, and I, in fact, met Dr. Lakshmi Vijayakumar in a clinic, and she was one of my biggest motivators because she's been doing this work for more than 2 to 3 decades now, tirelessly. So I want to point out that when somebody is suicidal, uh, suicidality is a short-lived crisis because you can't keep having that pain for a long period of time. 8 out of 10 individuals will give out verbal, non-verbal, or written signs. Picking up these signs is key because then you can respond to these signs by asking the person how are they doing, by listening to them, by not judging them, by letting them know that their lives is important and there is hope and they can continue living, and to then communicate to them that they can get help for this. And in most cases, like we were talking about, 50 to 60% of the cases, there's an underlying mental health related issue. But that's not the only cause as to why somebody's feeling suicidal. But at that point in time, they require specialist help. But in a country like India, where we do not have enough mental health personnel or the mental health infrastructure, we have about 50 odd government hospitals, and we have very few psychiatrists, psychiatric social workers, clinical psychologists. We need to train the public. So there is something which is WHO recommended intervention, which again in a report which is which Dr. Lakshmi Kumar contributed to, which came out in 2014, called Preventing Suicide: A Global Imperative. Gatekeeper training, along with perhaps emotional first aid, can train laypersons to be able to pick up these signs, because most of them are not going to pick up the phone and call. Think about the situation right now. There have been a lot of crisis helplines that have come up. But what I'm hearing from them, and we've trained some of them in gatekeeper training, but what I'm hearing is that the call volume is dropping. With some of them, it is picking, but with most of them, it is dropping. Perhaps what is happening that in the confines of your home, if you have people listening around you, are you going to pick up the phone and then give them a call? Because it's difficult for you to do that, especially if the problem that they're going through is at home. So we need other options that are available, including something like what the US has, which is the crisis text line. Young people prefer to text. So crisistextline.org gets hundreds of thousands, if not millions of texts. So we need to be able to. So if, when somebody is suicidal, if they know that you are ready to listen, they will reach out to you, and you are in a position to help them during this time, and a suicide can be averted. So what is cause for hope? 9 out of 10 suicide survivors will not go on to die by suicide. 7 out of 10 suicide survivors will not make a second attempt. What it means is that if they get the help in the moment of crisis, they will not even have made that attempt. But I also want to point out that what we are looking at is like Dr. Lakshmi Vijayakumar spoke about, suicide is not only about mental illness. It's not only about the social, cultural, political, economic factors that are there. In a time like COVID, we are also facing economic uncertainty. We can look back at 1929 about during the Great Depression. We can look at the 2007 crisis, and there are some lessons there. Countries which introduced an economic or a social safety package had made sure that suicide rates were flat or even lowered. But countries like Greece, where they had issues with the economy and they couldn't have a social or a economic safety net, suicide rates increased. We need a public engagement campaign to talk about, increasing awareness about suicide literacy, reducing the stigma, busting taboos. Also, what we need is a bigger conversation around the fact that we are at a state where, for the first time, we have a time to change mental health in the country as well as the conversation around suicide prevention. We need a suicide prevention policy. Countries like Finland, countries like Sri Lanka, countries like China, after they introduced a suicide prevention policy, saw a drop in suicide rates, and they saw almost this halving or reducing by 70% and so on. We need a strategy, and we need it now. We also need to implement the Mental Health Care Act 2017. That costs 93,000 crore every year to implement. We need to find a way to fund it. This is the time. We've realized that mental health is important. Suicide prevention is important. We can't have so many suicides happening in the country every day and losing young people. We're going to have a lost generation. The repercussions of this, we're going to see for many years to come.
Yes, in fact, the problem also is that since it never becomes part of our daily conversations or not, regular conversations, it doesn't become part of a larger focus even for your authorities or your governments. I mean, the amount that is allocated just for basic healthcare is so bare minimum in our country, let alone the mental health care part of it. There are a few awareness programs that have been initiated, but not enough. Even during the pandemic, the government itself, if you go on the government health ministry website, they do talk about this as a big fallout and a big impact of COVID being on our mental health. But beyond that, we've not seen any initiatives. And I think while it is a bigger responsibility of the society, of all of us individuals, some amount of initiative from the government may also be necessary at this point when the situation is becoming a little grim. Now, let me go across to our viewers, and I've got a caller on the phone line who has a specific query. I believe Colonel Holkar is on the phone line, and Colonel Holkar is calling us from Gurugram. Good evening to you. Go ahead, please. Do you have a specific query?
Yeah. So basically, hi everyone. Good evening to everyone. What I would like to say is that I've worked in the army and I have also worked in the corporate for quite some time. I recently have launched one of my own initiative. It's called Art of Working. And Art of Working actually focuses on science of happiness at work. One of the major silent people who are the sufferers of this entire anxiety, stress, and societal tendencies are in fact the professionals. And now these professionals, when they are working from home, you can see how much this stress has increased further. Even that small island called home is now not left untouched. Moreover, all these economic stress where people are doing their job and losing their jobs now in much more numbers, pay cuts, salary cuts, extra work, and all those kind of things is only adding to the stress. So what are our schools and colleges are doing? In Art of Working, one thing which I have realized is we make great doctors, we make great engineers, we make great management professionals, but we do not make great workers. We never tell them how to be resilient, how to be agile, how to be more dynamic, how to be comfortable in discomfort, how to manage their work life. 50% of your wake hours is work. More than 60% of your life is work. One thing we are not telling our working professionals is how to work, how to manage bad bosses, toxic environment, work pressure. And even if you lose your job, you have not lost your life. So that is where the initiative should come. It should not come to the point of suicide. That is the last thing that you can look at. The golden hour is much before you consider that person to be a suicidal person. So what is the government, all these organizations actually making our youngsters right from class 5 onwards to the colleges, resilient to take on these things which are going to happen so regularly in the world now.
Fair enough. In fact, from what you said, I will pick up this one point: the responsibility even of the corporates, the employers, to guide, to counsel the staff members, to provide an environment where, if anybody is going through a problem or a condition or wants to talk and reach out within their office, they have opportunities and options to do that. And that's something that I think more and more companies need to start looking at. Many have begun, especially during this pandemic period, but needs to be done at a larger scale. Let me also see, thank you, Colonel Holkar, for calling us. I think we also have Nina, who's on the phone line from Mumbai. Good evening. Thank you so much for calling. What would you like to share with us?
So I want to share my personal experience. Yeah. Good evening and hi to everyone.
Yes, Nina, go ahead. Please mute your TV so we can hear you better. Yes.
Yeah. I'm very happy that you've taken up this particular issue on this World Suicide Prevention Day. And I myself, being a victim of depression for last 4 years, and I'm going through it, and I know I can feel it, how one goes through it, and it is unexplainable. Nobody around you understands you when you are going through this particular phase. And I know suddenly something went wrong and I was not finding interest in anything. And so there was a miss, a person who goes under depression and has suicidal ideation cannot explain what is happening to him, and it's very important to have a support system. And unmuting yourself, unmute and stick it out, The people around you should be very supportive. And very rightly said by one of the panelists that listening is very important. Somebody should be there to listen at that particular point when you're feeling very, very low. Because that particular moment is very important, which takes you to the suicidal ideation and those thoughts. So I'm very happy to share now. I got to know about my depression. I went to the psychiatrist. I took the professional help, and I'm feeling better now. I'm still on medication. I'm all alone in this pandemic, and for last 6 months staying alone. But hats off to our psychiatrists and professional help that I'm doing well. I'm doing fine, and I'm out of it. So unmute, seek a support, speak it out. Let world know what is going on within you. Don't keep within you, because then it piled up. And once it piled up, then anything can happen. It's like that. So thank you so much for patience listening. And this was what I wanted to just share. Thank you.
Thank you. Well, it's so good to hear, Nina. It's so good to hear that, you're doing well, that you've got help, and from your own experience, I hope others also get the encouragement to speak up, to unmute, as Nina puts it. Nina calling us there from Mumbai. Dr. Lakshmi Vijay Kumar, if I could just come to you on what are the current options, available for somebody who wants to reach out, especially in times of a pandemic where you are supposed to maintain your distance, you're not really socializing, maybe texting or a phone call is not the way, is not comfortable for someone. What is the option for them in terms of getting help?
See, when we talk about suicide and COVID, we have to see, actually, if you really look at it, if we look at the real-time data on suicide, countries like Japan, New Zealand, USA, in the initial stages of COVID, there is a dip in suicide. And that's because it is the Durkheimian theory. Everybody feels we are all in this together, a sense of, this is affecting all of us. So even people who are not integrated feel a little bit integrated. But it is as both Dr. Rajesh and Moses said, it is the economic fallout of this which causes a problem. But unfortunately, in our country, we are actually witnessing an increase in suicide even in the early phase of the lockdown. And that is due to a variety of factors. For example, sudden closure of alcohol outlets had caused a lot of people to go into alcohol withdrawal symptoms, confusion, domestic violence, and suicide both of the husband and sometimes the wife also. We did a small study, it's not yet published, so I'm not able to share the complete details with you. But we did find an increase in the newspaper reporting of suicides during the first phase of the lockdown. Before, the first till 3rd of May, there has been an increase in suicide. And we have seen a small change in pattern also. We found that it is men who are employed who are into more suicide. And if at all there is a small silver lining in this COVID, every year we lose about 2,500 students because they have failed in exams and they die by suicide. Okay. For the first time in 20 years, I haven't picked up more than 2 students to suicides because they have failed in the exam. Because majority of the exams have been cancelled or postponed, or students have been passed. So actually, 2,500 young lives have been saved, which makes us think about our educational system. See, for a long time, we have been debating, is it the individual vulnerability which makes a person suicidal, or is it the societal pressure which makes a person suicidal? This idea has divided and dichotomized our way of thinking. It is both. Suicide, nobody dies of suicide because of a single problem. It is always multiple factors occurring together. It could be, there is biological factors, there is psychological factors, there is social factors, there are cultural factors, there are religious factors, and sometimes even philosophical factors also. All these factors combine together to cause suicide. So there is no single suicide or caucus which causes suicide. Unfortunately, we have a tendency to simplify suicide, exam failure suicide, low failure suicide, things like that. But there is always a multiplicity of factors. But the other thing about prevention is, many of the people feel that, look, it is an individual, how can I change that person? Or it is poverty, what can I do about it?
Right.
But we have evidence-based suicide prevention strategies. We have 3 categories of strategies. What is called as universal strategies, which you apply across. For example, in our country, in rural area, pesticide consumption is the commonest method of suicide. If you are able to reduce access to pesticides, many suicides can be prevented. Many impulsive suicides, many rural suicides can be prevented. These are universal strategies. Reducing alcohol availability and consumption is a universal strategy. Media. The media has a huge role. Sensational reporting of suicide can cause further phenomenon and increase suicide. Sensible portrayal of suicide in the media can trigger a Papagenos effect and reduce suicide. Then we have what is known as selective interventions. These interventions are for people who are at a higher risk of suicide. For people like, say, farmers, people who have with mental health issues, people who have lost something, people who have painful physical conditions. So these people are at a higher risk of suicide, where we have to have better health system and better knowledge about, awareness about suicide among a variety of people. It's not only health system, it is teachers, it's policemen, and what he said, all the gatekeepers, nurses, everybody should be aware about what are the signs of suicide risk, how to identify, how to provide immediate support, and how to refer. Then we have what is known as indicated interventions. People who are already suicidal. People who are already suicidal, what can we do? We have specific strategies. For example, we have safety planning cards. We know that helplines does reduce suicidal thoughts and suicidal emotions. And for people who have attempted suicide, we know that providing contact for the next 18 months reduces suicide. Something very simple, like sending a postcard. Even in a developed country like Australia, they send postcards, 8 postcards to people who have attempted suicide. And at the end of 2 years, they found that those who received postcards have
Right.
much less suicidal repeat attempts of suicide. So what we have to understand is, whatever be the problem, the final emotions of the person who is suicidal is a sense of loneliness, helplessness, and hopelessness. Okay, and the loneliness, as everybody else has said before, can be reduced by empathetic listening of another human being. Simple listening and understanding, conveying the message that I care, I understand, I am with you, reduces the loneliness. And even if you cannot do anything about the stress of the person, reducing the agitation. See, majority of the people who want to die really don't want to die. The wish to live and the wish to die is like a seesaw.
Dr. Vijay Kumar, yes, Dr.
Yeah,
Vijay Kumar, if I may just come in here and pick up from the points that you've raised, I just want to go across to Dr. Rajesh Sagar and Nelson as well. But Nelson, to you first, and then to Dr. Sagar. Specifically, when it comes to youngsters, students, dying by suicide is a huge problem in our country. It's on a large scale. 10,300 students' lives lost in this way just in 2019. And if you talk about this specific year, where there is so much of uncertainty about their entrance exams, college exams, school exams, going to school, not going to school, an entire calendar year, it's just going to add to the stress. How do parents deal with that? How do students deal with that? Any specific advice that you would have for the parents?
Right. So I would say that the problems. I'm glad that there have been no exams and associated suicides with exams. But on the other hand, for a lot of them, they're graduating, indoors. They're spending their last year of college, in lockdown. For some of them, they're supposed to study abroad or apply to colleges, or their social networks are largely outside. Young people are basically learning how to be adults. So how is it that, I think the first thing is there needs to be a creation of a way for them to get out and to be able to to continue doing some of the things that they were doing earlier, and to do it in a safe environment, whether this is nature, it's outdoors, whether it's exercise, whether it's gyms, and then maybe have digital connectedness, but in a way that is allowing them to share and feel connected at the same time. The problem with, again, with parents and children, and I had a recent call from a parent, and the difficulty with communicating to somebody who's just growing up, who's just maybe consuming marijuana and with his smartphone, and suddenly having a big gap in communication. So how do you deal with that? I think parents themselves, who are undergoing tremendous pressure right now, need to be educated as to how to communicate to children, as well as understand their own feelings, and perhaps find their own ways to be able to express and find connections with other parents, maybe find support, maybe even seek therapy, so that they can take care of themselves. Because if you're not able to take care of yourself, you can't communicate. But clearly, I think the government also should launch a public engagement campaign. Corporates, we spoke about the role of corporates, the role of media. Media should also have a public, along with the government, have a public engagement campaign. Corporates can also open up a way where young people can engage with whatever it is, whether it's digital or non-digital, but find ways to not be alone, right? So if you're a young person and you're from the LGBT community, how do you reach out to somebody from that community? If you're a young woman and you're forced into getting married, is there any help for you? If you're a young man and you're thinking about an uncertain future, is there a way for you to at least have a gap year so that you can get back? So there is research that suggests if you were to not get a job or get a low-paying job that continues for many years, even when the economy gets better. So employees have a role to play, the government, and I think even civil society, find ways for them to go about adulting, to get out and find ways, as well as to be digitally connected in a way which is healthy. So social media apps as well, Instagram, Facebook, and other, Snapchat, also have a role to play. Yeah.
Right. Okay. And then I take the point that you're making. But if I can just go across to Dr. Rajesh Sagar. Dr. Rajesh Sagar, one other query and a thought that I had was, of course, that we need a lot more people to be able to, feel comfortable enough to speak out, share with their friends or family, or, reach out to a professional help, whichever way. But the other aspect also is the mental health care professionals, the counselors, the psychiatrists, the psychologists, and we don't even have enough of them in our country. Now, in times like that, like what we are living through right now, I'm sure it's becoming exhausting even for the healthcare professionals. What's the solution there? What can be done to have more of all of you in our country?
No, I think one of the important thing is that what is being thought that it has to be done at multiple levels. One is that the strengthening of psychiatry for in the MBBS curriculum itself, because it's much needed, and some efforts have gone by in recent time, because earlier it was so minimal. So and most of the what we understand, that many patients, they come to a general doctor and they feel that they are not equipped enough to handle. So that's one level to be done. And the other thing is that we need to see that how we can promote how one can take this psychiatry as a subject. Now we have more number of seats. Let me tell you, since I work with policy, so in recent time the number of seats in psychiatry also have increased. But also there is a lot of stigma attached to people who take up psychiatry, and so overall general perception about psychiatry has changed only in the COVID time only. I think it's very unfortunate that the mental health importance have come during this COVID time. We need not wait for such situation. So I think that is very important. Also, since we were discussing about young people, at the AIMS we did some study, in the sense that during the exam time and during the result time, the number of attendees are increased, especially the casualty. We have big casualty services. So there are a few things which are important. One of the hidden morbidity is bullying, in schools and colleges, which is not talked about. And since we are talking about young people, because we have to have a special reference for young people, because 15 to 19 years and 15 to 29 years, they are the major group, like in our country, and more emphasis needs to be there. It is sometimes said it is either number one cause or number two cause. Maybe road accidents are number one in some places. So that's a very vulnerable group, and there are certain conditions, the way young people are isolated. Even something like what sometimes we have come across, someone has commented on the looks itself can lead to a suicide attempt. And even to that you are obese, you are not looking good, you are bad, sometimes the comments which are made insensitively about any person can also be a triggering factor. So we need to be aware that that how we can teach to the society, to the family, and to have someone to them, because the important thing is that when the moment of crisis is there, you need someone to talk, you need someone to interact. And if you are able to do it, then obviously there is an outlet, it goes down, one to show that we care for you. So I think these are some of the important things. And also the barriers
that,
which
of
are
course,
there,
I
I think
mean,
we
when
need to
to
look
have
at those.
somebody
Pardon,
yes,
you were
Dr.
saying
Sagar,
something?
like you said, to have somebody to talk to obviously makes it easier and becomes a starting point. For many, though, they would need more help and more professional help beyond that as well. But a strong support system, of course, is extremely important. I am running out of time, but since we did ask our viewers to call us up and participate in this, let's also listen to what Nandini has to say. Nandini is on the phone line. Good evening. Go ahead, please.
Good evening, ma'am, and good evening to everybody, and thank you for bringing up this topic. One thing that I would like to say is most people who undergo depression or anxiety or suicidal tendencies, they have childhood trauma. So it is very important that, parents give a safe environment to children and don't expect perfection from their children. at least what I have seen in India and probably even my own experience was that, I had a lot of emotional neglect and which turned into other issues in my adulthood. So it is very important that, childhood trauma is taken care of and, parents are helpful and parents understand that they have to be protective of their children and they have to be, helpful to their children instead of always putting their children down or saying things that hurt children all the time.
All right, Nandini, you made a very valid point. Parents need to be a lot more aware and conscious of, providing that safe environment for their children as well, to ensure that there isn't any traumatic experience. And if there is, that it's immediately addressed to. I'm completely out of time, but it's been a pleasure to have all of our panelists with us tonight for this conversation. Viewers, in our country, and you heard it from the experts, a number of suicides every day is a massive concern, and we just don't talk enough about it to address it as a big issue. So let us tonight make a resolve that from here on, we will be a lot more careful about what's happening around us, a lot more aware of what's happening around us to our loved ones. How are they behaving? Are they trying to reach out? Are they, behaving in a way that they normally don't? Why is that? Do they want to talk? Let's listen. And if we are one of them who wants to reach out, let's do that. Reach out for professional help or to somebody around you. Let's together acknowledge and then tackle this entire issue. Thank you so much for joining us on this conversation.